So today we've got three different sessions. We've got, first up, we've got Maddy Leigh and Kelly Dienaar.
Dienaar,
Dienaar, yep. And they're going to be presenting Food Fight, advocating for stronger policies against unhealthy food marketing on public transport and public transport infrastructure. So I'll turn it over to you guys.
Thank you.
But 20 minutes, and then at 15 minutes I'll give you a 5, and then I'll give you a 1 minute after that, and then we'll wrap up, and then 10 minutes for question and answer, and then we'll move on. So
sounds good. Thank you, and hello everyone. Before we start, I'd like to acknowledge the traditional custodians of the lands we are meeting on today, the Ngunnawal people of the Kulin Nation, and I'd also like to pay my respects to their elders past, present, emerging, and extend that respect to any Aboriginal and Torres Strait Islander people that may be joining us today, both in person and online. So, very different topic to what we're presenting. You're good? Very different topic to what we were presenting yesterday. So today we're focusing on our Food Fight campaign. So Food Fight is an advocacy campaign that aims to get the Victorian government to establish legislation to remove unhealthy food and drink marketing on outdoor placements within 500 metres of schools and places where children learn and play. Food Fight encourages the persuasive parents peer group to demonstrate their support by engaging in various tactics, including an innovative MP writing letter tool that we developed using AI. And preliminary evaluation efforts have indicated success, although we haven't had ultimate success in removing junk food advertising as yet. So in 2017, 2018, 1 in 4 Australian children aged 2 to 17-year-olds were overweight and obese. So without preventative measures, excess weight can track into and worsen into adulthood. We know that adults with excess weight have higher risk of chronic diseases, such as including 13 types of cancers. There is strong evidence that children and adolescents' exposure to unhealthy food and drink advertising influences their food choice and preference and purchase request and increases food and calorie intake. As such, one important piece of work recommended from the World Cancer Research Fund as part of the comprehensive unhealthy weight prevention strategy is the restriction of unhealthy food advertising. So unhealthy food and drink companies are spending hundreds of thousands of dollars in Victoria yearly advertising near and around schools. An audit of 558 public transport stops in 10 suburbs within a 20k radius around Deakin University identified 233 food advertisements, with more at train stations and bus and tram shelters. Train stations at more disadvantaged locations had significantly more advertisement for food and junk food and unhealthy food and junk food and drinks. The Food Fight campaign was therefore developed to drum up support and advocate for changes in unhealthy food and drink marketing on public transport infrastructure, and within 500 metres of schools. We know parents, including grandparents and caregivers, are the most engaged group when it comes to the health and well-being of Victorian children. They want the best for their kids, they want them to be healthy and happy, but their efforts are often undermined by unhealthy food marketing. Persuasive parents were identified during 5 exploratory dial testing surveys. Parents were classified as either supporters, opponents or persuadables of our analysis of the problem and solutions to healthy eating policy. Depending on how the issue is framed, persuadables can sometimes agree with opponents and sometimes with supporters. Across all 5 surveys, the persuadable segment were the largest group, comprising of 52% and 69% of the total samples. And this was using Common Cause along with Vic Health in 2020. So, focus group research identified that persuasive parents are most likely to support the food fight if they feel that their own community can support the cause. Evidence from year one of food fight shows that parents believe that they are responsible for what their children eat and possibly that it is up to them to protect their children from advertising. So in terms of the strategy, what we're wanting to get persuasive parents to think, feel and do. So we want them to think that there are too much unhealthy food and drink advertising purposefully targeting children and that the industry is purposely using tactics to drive sales. We wanted them to feel angry. We wanted them to feel angry at the industry and the industry's manipulation, and we wanted them to unite with those around them to make the change and feel that there was something that they could do about it. In terms of the action, we wanted them to sign up. We wanted them to write a letter to their MP, and we also wanted them to upload examples that they had seen on their streets. Okay, so in terms of the theory, the grassroots theory informed the community-focused amplification strategy, and bespoke tools were developed for the campaign during the second year. Messaging included LGA-level data to build a sense of community support, whilst the Write to Your MP tool made it easy for community members to escalate their concerns to local areas. I'll now hand over to Maddy, who will talk you through the interventions that we developed off the back of the strategy.
Thank you. So we're going to go a little bit backwards to go forwards and go through the learnings from our first year of the campaign, which there were aplenty. And then we're going to hit the fun stuff, which is our AI writing tool. So during the first year of the campaign, it was very much around priming and educating our audience between that link of unhealthy food and drink and cancer. So using those stats around the 13 types of cancers coming from unhealthy food and drink. It was also about exposing unhealthy food and drink advertising tactics by uncovering that kids see at least 25 unhealthy food and drink ads daily. And finally, it was very much about empowering individuals and communities to become agents of change by signing up to the food fight. This ran in 2022, and we're going to play the ad, which was a bit controversial, so we know this. When you see it, don't judge. Go.
Our children are hit with at least 25 unhealthy food and drink ads daily. This has a powerful influence on what kids eat and increases the risk of 13 different types of cancer later in life. Together, we can stop the processed food industry influencing our kids. Search Food Fight online.
We'll discuss a little bit of that in our results, but we'll just move on to how it actually came to life first. So we looked at a full ecosystem approach because we wanted to make sure we were balancing breadth and depth of action. In year one, it was very much about fueling that awareness funnel. So we really wanted to make sure we're doing this at all levels and that we're engaging key ministers like the Health and Education Minister and Transport Ministers, as well as looking at local government level relationships. We knew they were really important to build community momentum as well. Organisationally, we got respected brands to support us like Diabetes Victoria, Heart Foundation, Vic Health, Varcho, just to name a few. And these stakeholders really helped to amplify our messages to their networks. The focus of the campaign at the time was more around that individual and interpersonal level, where we ran quite a large paid media campaign using TV, online video, social media, digital and search, targeting those persuasive parents, really encouraging them to sign up. We also created a Food Fight webpage with more information on the links between unhealthy eating and cancer, the industry manipulations and the advertising approaches, how the government can make changes to help with this, and finally, how persuasive parents can actually help the cause by signing up to Food Fight. In terms of results, we had an evaluation which showed strong evidence around the influence of advertising near schools in line with the policy ask. There was evidence to show that there was concern over the role of advertising and the motives of the processed food industry, and also some evidence that Food Fight may have increased the strength of parents' own perception of their responsibility for what children eat. So that was a bit of a negative connotation, and something we're very aware of. I think when we were setting up this campaign, we didn't go as strong as we probably would have liked in framing the government as part of the answer, and it's certainly something that was a learning for us in the next year. The positive, though, we had over 10,000 Victorians signed up to Food Fight, which was really exciting and something completely unexpected to us. And we did have some backlash around the video that we showed you before. So there was a Grew and Transfer episode where there was a bit of a debate about it as well. You know, always good to have some debates about advertising. Russell Howcroft was very supportive, but then we had Will Anderson who was quite negative about it. So it really made us reflect on what we were using, and when we went into market halfway through, we decided to pull our video and focus more on some of the digital static assets to make sure that we weren't causing any issues or making anyone feel uncomfortable by seeing our ad. So in terms of learnings from year one, really important obviously to bring along politicians and members of parliament for the journey, really making sure that they are comfortable and supportive of messaging and timing. This is something we really made sure we did, but it probably also led to us diluting a little bit of our messaging around putting them front and centre as the solution. We also need to really make sure that we frame our messages to make it clear that parents are not to blame. That is not the point of this. We are putting industry at front and centre rather than doing the blame with the parents. And finally, the creative approach does need to reflect that we want to protect children, both in messaging and in visuals, something that probably our approach didn't have. Off the back of that, a little insight from Kel and I, when we filmed that ad, it was actually unfortunately COVID times, so we weren't really allowed on set. So a big learning from us as well is we are never not going to be on set again. We are making sure we're there to make sure we're capturing what we need. So we really did want to go into market a little sooner than we did with our year two, and a bit of context about what happened between year one and year two for us. We took learnings, we started to apply them to develop new creative and look for a way forward with our campaign. We nearly got there, and then the Victorian Greens Population Health spokesman, Tim Reid, came out in the media in support of reducing unhealthy advertising around transport because of the links to kids' unhealthy eating and also going to hospital admissions. Dan Andrews at the time, who was our Premier, had a very negative reaction to that. He said, I think we should try and educate families around the state and to make the right choices, which was the complete opposite of what we were trying to do. So that put a bit of a break on what we were doing. We kind of had to stop, reassess, think about environmentally, was this the right time to continue? What should we do?
I might just add that Dan Andrews wasn't briefed on it, so it was
No.
an off-the-cuff comment that he had said.
Not great, yeah.
Great.
So yeah, we kind of went back to the drawing board, and then I think a couple months later, Dan Andrews then resigned as Premier. So then we kind of went through the process of Jacinta Allen coming into power, a new cabinet, trying to re-establish relationships with the new ministers as well. So there was a lot of a much bigger break compared to what we would have liked, but I think it really speaks to making sure that you are putting yourself out there at the right times and using the right levers that you can. So on to year two. Finally, we launched again, and based off our learnings from year one, we really want to make sure that we developed a new and less controversial creative, one that could build a bit more of a community feel around it and make persuasive parents really feel like they were one of many. Our focus was very much on continuing to expose unhealthy food and drink advertising tactics, mobilising individuals and communities, and empowering individuals and communities to become agents of change. So here is our second creative.
Every day, Victorian school kids are bombarded with at least 25 unhealthy food and drink ads, including bus and tram stops, train stations and billboards. They're everywhere. But you can help protect us from junk food marketing. Join the thousands who have signed up to Cancer Council's Food Fight. Together,
I can do it again. No, we'll go.
So
I think you said together you can join the fight, or together you can join us on the fight, and then the full faction.
yeah. So like in year one, we really made sure that our approach was across all levels. We obviously had to re-establish some connections with key ministers and create new relationships as well. And from a more community level point of view, we also had a few existing relationships and organisations that had come on board who we could work a lot closer with to actually bring to life community activations. Organisationally, we had more than 30 organisations on board already in year 2, which was really great to help us disseminate our Food Fight messages. And at that individual and interpersonal level, we focused more on a social media campaign. We had a far smaller budget for the year, so we wanted to make it work harder. We developed a full funnel approach within social using the likes of influencers. We did some really cool geo-targeting where we pulled in data around the number of people in that LGA who had signed up to make it feel like it's a bit more of a community. And we also used tactics like sign up and trying to drive conversions through the actual platform itself with drove efficiencies. We also updated our website to include a new tool. And this is our AI writing tool so that supporters could write to their local MPs to rally for support. So we knew that letter writing to MPs was a really crucial part of driving advocacy campaigns, and it really demonstrates active engagement, showcasing to MPs that the issue has public support. So a carefully crafted and personalised message is really important because it helps it stand out compared to mass-produced generic ones. The more effort someone puts into the letter, the more likely it's to be noticed and the more likely it'll be taken seriously by an MP. It's because MPs tend to prioritise unique, thoughtful communications. On the other hand, we also know that people, and especially persuasive parents, don't have the time to sit down and curate a lovely letter that is individualised. So we really want to come up with a solution that could help with this, something that could take less than 3 minutes. So I don't know if this is press play already. This is me using our tool, 45 seconds. Yeah, press play. So all you had to do was put your name in. It hasn't played yet. There we go. Put your name in, add your email address. I can't type, which you'll see in a second. Backwards, forwards, there you go. You choose your postcode, and once you've done that, it'll automatically populate with your MP. You pre-select from 2 drop-downs around what you've observed and what your major concern is, and you generate. And as you'll see on the side here, a letter is written to you, for you, by AI. From our platform, you could then send directly to the MP because we've plugged in the email address. You could obviously also update this if you weren't happy with how it was written, as you would with more AI across the board, and send across. So we were really proud of this tool that was developed. It was a massive team effort, and we'll talk a little bit more around some learnings of that in the last slide. So very quickly, in terms of results, we unfortunately didn't do an evaluation on this burst, but what we did see was 98 people wrote to their MPs, taking approximately 3 minutes or less each. We had an additional 2,500 nearly statement signs, which I know seems a lot lower than the first campaign, but they were far more cost efficient than our first campaign, which was really exciting. And whilst we didn't evaluate, what we did see in the Shape of Australia Victoria results was that 98.6% of parents strongly agree, or somewhat agree, that government has a responsibility to protect children from unhealthy food advertising, and that 43.9% agree that children should be free from the influence of unhealthy food and drink advertising. So finally, with our learnings from this, you need to be agile. Things don't always go your way. That's one very big thing to think about in terms of timings. AI, language prompting and risk aversion levels can really, really help. So when you're building an AI model, there's a lot you can do in the background to really prompt and make sure that you are removing some of that fluffy language that it kind of has. There's a few variables you can play around with in the background. You want to use simple methods to build more variety with AI prompts. So that was what we did at the bottom, just having 2 different AI prompts that we had there, drop downs with 4 ideas in each, really meant that the model couldn't go too crazy, kept it in line. This is the fun one, and Kel had a lot of fun with this. You want to try to break AI. You want to kind of try to put yourself in the place of someone who is going to use it for bad, and really try to break it to make sure that you can build that into your model. So doing cheeky things, putting like your little kid hat on and thinking about what they might do. And finally, localisation at scale really helped drive higher engagement. So compared to our first burst, we definitely saw that our assets that spoke directly to an LGA, had information around the number of people in that LGA that had signed up, drove far better engagement and far better sign-ups as well. And that's us, I think, perfectly on time.
Does anybody have any questions?
Go for it.
Fascinating presentation, thank you. There are lots of aspects I could ask about, but I'll zero in on one. When you said build ministerial relationships, can you talk to us about what Cancer Council Victoria does to build these? And is it around a specific campaign like this, or just about we are Cancer Council?
Look, we could spend hours on this. We have Jane Martin, who I don't know if anyone knows Jane, but this is her area of expertise, and she's a powerhouse when it comes to this type of work, and it's her bread and butter is building those relationships. I would say two things. One, we basically agree or we advocate for no surprises. So obviously Cancer Council is in a somewhat challenging situation in that a lot of our funding for a lot of our public health work does come from government, and so therefore we are partners with them, and we are on the same team. But at the same time, for this particular campaign, we really need to make sure that we're advocating for things that we believe in and changes that we want. So making sure there are no surprises is one of the first things. So making sure that we're briefing them, we're giving them opportunity to respond, and respond preferably in the way that we want them to. So obviously what happened with Dan Andrews was just an off the cuff. The Greens said something, he responded to something that he knew about 5-6 years ago and wasn't briefed properly. So that's an example of when, if you don't brief them properly, it goes wrong. We also not only just work with obviously health ministers, etc., but it's also all of their advisors and the team that works behind them. And the biggest problem that you have is when they change. A file goes in the drawer, and then no one knows where that file is. So, you then have to go through the process of briefing again. So, that's a very short answer to that question.